How are you a doctor already, Adam? You look way too young for that.
I get that a lot. I think fortunately the hospital hasn't aged me physically as much as it has psychologically. But
Wow. What
but
are
yeah, no,
you
I
what are you
mean,
in your early 30s now?
yep, early 30s. I've been involved in, medicine and cancer research in some form or another since high school. So I may look young, but I've had my fair share of experiences for better or for worse. And I think what I've really learned along the way is, how much we under prioritize public health education and specifically talking about cancer prevention when it comes to cancer care. And that's what inspired me to want to write this book and get the message out there.
Yeah, and the book which we've linked in the show notes, Outsmarting Cancer. We're going to get through some of the main themes. What drew you to this whole thing? You've been interested in this since a young, teenager. What was all that about?
Yeah, so unfortunately, cancer in some ways runs in my DNA. My grandparents, who raised me, fell ill and ultimately passed away of these rare blood cancers back when I was very young in middle school and high school. And they inspired me to get involved in cancer research. And that's what led me to realize that their early deaths may have been due to radiation exposure from the Chernobyl nuclear accident in Ukraine. And that really set me down the path of realizing how many day to day exposures each of us face in the food we eat, in the air, the water, in our lifestyles that increase our cancer risk. And as I've, progressed in my career, I've gotten to work with patients day in and day out in the clinic, in the hospital. It's really made it all the more important and urgent for me to be able to share those findings, the most recent data with the general audience, because I'm realizing how little we talk about and how little people know about cancer prevention, and we're doing a real disservice to all of our patients and people around the country, around the world, by not talking about it.
Yeah, well, we do so much prevention in so many other areas. Even my little one of my daughters, her favorite thing is smoky beer right now. She's 2.5 years old. Wildfire prevention for 80 years, blah, blah, blah. Wildfire, prevent forest fires. There's so many prevention type themes and marketing uh, uh, ventures out there. And then when it comes to cancer, it's so reactive.
Exactly. And same in medicine, right? We've all been talking about heart disease and cholesterol and blood pressure for years and years, right? But we haven't been talking about metabolic damage from our diets. We haven't been talking about cancer prevention. And I think some of that is, the data is more recent. We're only learning in recent years about all these various risk factors that we weren't aware of previously. But another big part of it is truly, prevention isn't where the money is, right? Cancer is a very lucrative field. There's hundreds of billions of dollars in pharmaceuticals. And there's no real way for anyone to be incentivized or to be making money from prevention, right? It's what's good for society, but unfortunately, our politicians, our lawmakers, public health can be very short-sighted, and they're not interested in doing the things, investing the money in preventative measures that may save billions of dollars, a decade or 2 decades down the line.
How are your grandparents treated? What type of cancers did they have? And then how were they treated?
Yeah, my grandfather had multiple myeloma, which is relatively common, and this was whatever 15 years ago. So this was before all the new CAR T therapies and bispecifics. So unfortunately, he didn't live very long with it. And then my grandmother had a very rare form of leukemia, which we have no family history of anything like that. So that's part of why what has led me to think that maybe it was that radioactive exposure, because my family, they immigrated from an area of Ukraine not too far from where the Chernobyl nuclear meltdown was. And, much like our government kind of fails to inform us about so many things, the Soviet Union there, it really didn't tell people. They tried to cover it up for weeks, for months. People were out, in the rain, drinking the water. No one knew about any of this radioactivity that was being released until Western nations picked it up. So it's kind of, there was no kind of protection for anyone.
So, Outsmarting Cancer, this is the book which I said we'll want to get into some of the main themes. So let's talk about them. Let's kind of pick it apart and bring some value to the audience here. Several main themes throughout the book. One of which you kind of that you throughout the whole thing is cancer is really not just you hit the bad, some of us hit the genetic jackpot and some of us don't. And you're saying, hey, listen, it's not simply just you didn't hit the genetic jackpot. There's a lot of other factors that go into this. So why don't you start with that theme? Talk about that if you would.
Exactly. I think so many people have this conception, it's all family history. If my mom had breast cancer, I'll have breast cancer. The truth is that the latest data shows only about 10% of cancer cases are hereditary, as far as we know, as far as we can track down to any given gene. So the rest, the 90%, a lot of it is it's lifestyle, it's exposure to various chemicals, to radioactivity, to various forms of cellular damage in our day-to-day lives. And the biggest things that affect that, everyone knows smoking. Smoking remains the leading cause of cancer, but there's so much more to the story than that. There's obesity, there's ultra-processed foods, there's alcohol, there's many other factors that people don't even realize. We're exposed to radioactive gases in our day-to-day lives that most people aren't even aware exist.
Yeah, but okay, but then you have people that don't drink, that don't smoke, that work out, that eat clean, that live a very clean and pretty disciplined lifestyle, and then they still get that cancer bug. So what do you say to that?
Right. So that's the other half of the coin, right? If we're saying half of cancers are preventable, that there's something in our lifestyle we can attribute to that caused that cancer, the other half are not. Unfortunately, all of us are exposed to radiation from the sun, from the earth. All of our cells are producing thousands and millions of mutations every day. And so unfortunately that's a lot of the book is it is a lottery, right? There's no guarantees in life. There without a doubt there are no guarantees when it comes to cancer risk. But the best thing that we can do is make whatever choices we are amenable to, right? Make the small changes in our lifestyle that we can live with to try and mitigate that risk. Because unfortunately that risk will always be there. But it is impressive how much that risk changes when you change your lifestyles, right? How much higher the risk is for someone who is overweight, obese, drinking alcohol on a day-to-day level, smoking cigarettes compared to someone who's not. And that's where we can make a real difference by trying to make those lifestyle changes.
Right. And then when you get it, I would assume that those folks that do unfortunately come down with this disease, the ones that live a healthier, cleaner lifestyle, correct me if I'm wrong, are able to at least have a better chance of fighting this thing.
100%. There's so much data now that shows things like smoking cessation. So if you smoked previously and got lung cancer and then you stop smoking, your survival is better than any drug we can give you. Right. The not smoking is key and crucial. Same with being overweight, same with alcohol, right? All of these things that lead to cancer. Once you have it, nowadays cancer is very treatable. We've hit the 5-year survival of 70% overall across cancers. That's the highest it's ever been. It's remarkable, but it's still a disease that people have to live with for the rest of their lives most of the time. Often it's not curable and it's something you're going to keep fighting, you're going to keep getting different therapies for. And the best way to prevent it from coming back or keep it in remission is along with the medicine to make these sort of lifestyle changes to decrease that risk.
I get the cigarette smoke and the lung cancer type connection, but talk to us a little more. You've mentioned alcohol several times. Where's the connection there?
So alcohol, I think, as most people know, is not good for your liver. It's actually a toxin. It poisons the cells of your liver and causes them to die, right? And in the process of doing that, it can elicit mutations in those liver cells and stomach cells. And truly, cancer, if you want to simplify it, is a disease of mutations, right? It's a cell that has gone awry, that is not following its blueprint, its instructions, and dividing on its own, and eventually it kind of consumes its host. It uses up all the resources, it uses up all the oxygen, all the blood, and by virtue of dividing uncontrollably, kills the body that it lives in. And so what alcohol does is it causes those mutations in our liver cells, and any one of those liver cells can go ahead and become liver cancer down the line. And liver cancer is one of the leading causes of death around the world. As far as cancer deaths. And once again, alcohol, although liver cancer is the number one cancer that it causes, it's by and far not the only one. It can cause stomach cancer, it can cause bladder cancer, right? Alcohol is a poisonous substance, and truly the less we can consume of it, the better. Now, once again, with all of these suggestions, it's, I don't want to be getting on a soapbox, and I'm not perfect. I'll drink a beer here and there, right? It's not about trying to live this perfect ascetic life like a monk. It's about trying to cut things out where we can and make small changes in our day-to-day lives, because in the long run, those small changes can really accumulate.
When you have a drink, because you've seen so much already in your young career, when you have a drink, is it hard for you not to think about, oh my gosh, I may be increasing my cancer risk?
It's a good question. I think it requires a little bit of compartmentalization in life, because I think one thing that's important, I see so many patients with cancer who, once they get that diagnosis, that's all that they think about. Day in and day out, their entire life is, what can I do about this cancer? Where's the latest clinical trial? Like, this is all I'm going to think about. And unfortunately, I think that's kind of detrimental to quality of life as well, right? If we let ourselves be consumed by disease or fear of disease, we're not enjoying and living our day-to-day lives. So, moderation is key. I think it's so important to be able to live life and enjoy those moments. Sometimes have a drink with friends, sometimes go out and eat unhealthy food, but on a day-to-day level, try and make those decisions less frequently.
Yeah,
It's so, but still, not live a depressing life where you're obsessed or anxious, because then what's the point of living at all?
I totally agree. Everything in life is a balance.
Exactly.
Like if I try to live my life, Dr. Barsouk, between if the football field is the analogy, I live between the 40s. I truly with almost everything. It's just maybe my default, my makeup. You'll never see me in the red zones. Very rarely, unless I'm having an out of body experience. But I try to live in the balance. It's okay for moderation, but anything too much or too little sometimes it's not good. So it's kind of the
Exactly.
same theme you're talking about here.
Exactly.
But how do we avoid though? How do we avoid all these toxins and carcinogens that we're surrounded by? What are your suggestions?
Yeah, so I mean, that's why I wrote a 300-page book, right? There's
That's
there's
all
a
it is,
lot
300
there.
pages? Nice.
But I think among the highest yield ones, right? First off, it's what we put in our mouths, right? Our diet. So what can you do about that? We Americans now consume something like 70% of our diet is these ultra processed foods. It's all these prepackaged cookies, chips, snacks that are chock full of preservatives, many of which haven't been studied, haven't been proven to be safe. And unfortunately, it's very little nutritional value. Instead, it's just empty carbohydrates. These fast to process sugars and fats, which are terrible for your body, and they actually induce those kind of mutations and cellular damage that then leads to colon, to gastric, to breast cancer. So the best thing you can do is try and reduce how much of your diet is coming from those pre-prepared, ultra processed, prepackaged foods. Opt for whole breads, vegetables, fruits, water instead of soda, right? Anything you can do to get closer to what's available in nature, to what's real normal food, the better you're going to be. But that's diet isn't everything, right? There's what right the water that we drink has all sorts of chemicals. Sometimes people fall ill with waterborne illnesses. So
Mm.
it's something as simple as having a water filter, a charcoal water filter that you can buy on Amazon for $10, right? Having an air filter at home, especially if you live in a city with a lot of cars, with a lot of air pollution. Keeping your windows closed when the air quality is bad outside.
Mm.
There's so many of these little things. Testing, something like a quarter of Americans live in an area that has radon gas. It's this invisible radioactive gas that's found in our basements and on the first floor, which is the second leading cause of lung cancer after smoking. So it's as simple as go online, Google your zip code, and see if your area is an area that has radon gas. And if it does, you should test your basement. You can often get these radon testing kits for free from the state or local government, or they're $10-$20 online. But if you test your basement and find out you have the radon, there are things you can do to get rid of it. But if you don't, and you're breathing in that air for years, for decades, that's a huge cause of lung cancer around the country and around the world. So
Mm.
these are all small little fixes, that may take a few hours of time to really make a change, but they can make a huge change in the long run in terms of your cancer risk.
You alluded to the fact that so many people then become obsessed. I want to, before I forget that point, they become obsessed once they get the diagnosis and it consumes their every minute moving forward. So, Dr. Barsouk, I get this terrible diagnosis. I have I have cancer cells forming. You give me the news, I've got a tumors, whatever. Uh, and I come to you and I'm being obsessed. What kind of advice do you have for me then to kind of change my mindset? How do I do that?
Well, I would first ask, what are you, if you really think and introspect, what are your goals going forward? Right. The question is, most people will tell me that their goal is not just to live physically as long as possible, right? Because people can live on a ventilator for years, but that's not quality of life, at least the way most people see it. I think most people will tell me that their goal is to have as long as possible a good quality of life, to be able to go outside, to spend time with their children, with their grandchildren, right? To enjoy the foods that they enjoy the activities they enjoy. And in that case, right, if our goal is to maximize that, then the best thing we can do is to let you get back to those activities for as long as possible. Right. If you're depriving yourself of the foods you enjoy, or you're scared, to go out to the park with your kids because you might get sick, is that really the kind of life that you are fighting so hard to maximize? And so at the end of the day, every choice you make, right, it's a question of what am I sacrificing and what am I gaining from it? And if you are consistently sacrificing every free moment of your life just thinking about the cancer, thinking about what you can do to try and fight the cancer or prevent the cancer, at the end of the day, what are you living for? Right. And it's, once again, that's so much easier said than done. I say this as someone who's not sick with chronic illness, thank God. Unfortunately, I've known many people who have. I've lost many people to cancer and other illnesses, but it's important to have that mindset going into it, and that's why it's so important we connect people with psychologists, with palliative care right away, so that people are continuing to have that conversation and thinking about and talking about what do I prioritize in life, what am I living for, and what am I willing to sacrifice going forward. Those are the kind of conversations we should all be having with our family members and with each other.
You say hidden risks are everywhere. We've touched on it, air pollution, plastics, UV radiation, environmental toxins, etc. One of the areas that I found surprising is that you mentioned sexually transmitted diseases, because people are going, what? You can get cancer from STDs? Talk about that if you would.
Absolutely. I think that, the biggest STD that I should hope is on everyone's mind is HIV, which, we've made huge strides in fighting HIV and preventing AIDS, but it's still out there. It's still very prevalent. And HIV actually leads to a number of different cancers. People may not realize this, but it causes skin cancers called Kaposi sarcoma. It causes lymphomas. It increases your risk of leukemia. So HIV as a diagnosis is besides having all the other impacts on your life, it significantly increases your cancer risk. And that's where safe sex practices come into play so often and are so important. The other one that I think a lot of people don't realize and honestly fail to act upon is HPV. Right? HPV is the same virus that causes warts and genital warts, but those certain types of the virus can cause those warts to keep growing, and at that point they become cancer of the cervix, of the penis, of the anus, right? And the I guess the silver lining is that we've actually basically found a cure to HPV, right? We have a vaccine that's 99.9% effective if you get it at the right age, that prevents that virus and prevents all of those cancers, prevents cervical cancer, prevents head and neck cancer, anal cancer. Unfortunately the downside is that the age you're supposed to get it at is around 11 to 12 to 13. And so many parents, that I interact with in my day-to-day practice tell me, I don't want to vaccinate my 12-year-old against an STD. It's like there's the stigma of, oh, we shouldn't, the younger adolescents, we shouldn't be thinking about sex. Obviously, they shouldn't be having sex. We're not going to give them these vaccines because we don't want to encourage them to be sexually active. But the important part is the vaccine works best when it's given early because that's when your immune system is forming. It's a biological truth. It has nothing to do with us trying to tell your child to have sex. It has nothing to do with whether your child is sexually active at 13 or at 30. Either way, the vaccine works best when given early. And so I think it's so important that all parents get that HPV vaccine for their children because it can prevent so many cancers down the line.
Right, but so I would be the same way though, doctor. If you told me you wanted to give my one of my kids a vaccine for an STD, I would be very much reluctant to that at 12 or 13 because I would be saying, well, I understand what you're saying. You're saying, well, we're protecting for later on in life. But what about like now? What kind of potential side effects does a vaccine have for a 12-year-old right now when it's not
Correct.
necessarily needed?
I mean, it's fairly well established that these vaccines have basically no side effects. I think there's been, I think a lot of people have concern from the COVID vaccines. There were those rare cases of like the heart inflammation, the lung inflammation from the COVID vaccine. That's a different form of technology, right? Those are mRNA vaccines. They worked very well, but they did have, once again, very rare side effects. Things like the HPV vaccine, that's a totally different technology. It basically does not have side effects. People have the occasional redness and swelling where they get the vaccine injected, and that's it. So I mean, I hear your reluctance. Once again, I speak to parents like that every day, and ultimately, it is 100% the parent's choice. Right? We live in a free country, and doctors have absolutely no right to give anyone anything that they don't want. But I always caution parents at the end of the day, unless you expect your child to never have sex in their lives, it is so important to try and get this vaccine in them at the right age because the earlier you get it, the more effective it is at preventing sexually transmitted disease down the line.
What would if the you said that the mRNA vaccines that's different. What is it like a spike protein? What's in those versus the ones that you just talked about, HPV, for example?
Right. So the way any vaccine works is it takes a little bit of a virus, enough for the immune system to recognize and introduces it into your body so that your own immune system knows what that virus looks like. And if it encounters it in the future, it's kind of ready, it's primed to recognize and attack it and defend the body. Now, the way you do that is you use different kind of pieces of that virus, and that has to do with how different viruses are packaged and it gets very complicated. But basically the COVID vaccines using mRNA, right? The mRNA is like the literal instructions of that virus. So they were introducing kind of like blueprint pieces of the COVID virus for the immune system to recognize. Whereas other vaccines that have been successful in the past with other viruses, they may use like a little piece of the outer membrane or of the layer surrounding the virus, right? So it's a different little molecule. It's a different chunk of the virus that you're providing to the body, and for whatever reason, when when you do the outer membrane, you don't get that same robust immune response, right? It doesn't send your immune system into overdrive the same way that COVID and the COVID vaccine do. So, different vaccines have different side effects. And once again, the COVID vaccine got a lot of bad rep in the news because of some of these rare side effects. And I want to make it clear that, the COVID vaccine was 100% effective and necessary and prevented, thousands and thousands of deaths. But the kind of side effects that we got with the COVID vaccine have not been seen with other viral vaccines like the HPV vaccine.
Hmm. Yeah, I mean, listen, and I know that this is we're talking cancer, but the COVID stuff for me, um, I didn't get vaccinated. I got COVID naturally. I mean, again, back to your point, if you're living a healthy lifestyle and you take care of yourself and you watch what you eat and all these things, you should give yourself a better chance for success. It doesn't mean that you're going to be invincible, but it's
That's
kind of the
true.
same approach.
I will say that's 100% true. We saw that on average, younger, healthier people had much better outcomes with COVID than older, sicker people with a lot of, heart disease, kidney disease, and so forth. And I think that's why the real population that benefited the most from the COVID vaccines was those older, sicker people, right? Those are the people for whom, when I see them in the clinic, I say, you have to get your flu shot, you have to get your COVID shot, because you've got a lot of, things working against you. If I see a young, healthy guy like you, I'll still, I still think the benefits outweigh the risks. But I think it's a much more balanced approach there than it is for someone who's older and sicker.
Sure. What about screening? I assume that that's one of the areas when it comes to cancer that people hardly ever do.
100%. And we've seen since the pandemic, actually, there's been such a huge drop off in cancer screenings. So many people kind of lost follow-up, stopped seeing their doctors, and haven't gotten their colonoscopies, their mammograms, their pap smears. And it is so crucial to get these because the truth is, when you catch the cancer early, it typically is curable. You can cut it out and it typically never comes back. You don't have to think about it anymore. Once it's spread, the genie is out of the bottle. It can't be put back. The truth is, once the cancer is spread, it is no longer curable. So that's why it is so essential to get those screenings at the ages that they're recommended, especially if you have any sort of family history, especially if you have other chronic diseases or you're overweight, or you drink alcohol or you smoke, you have any of these risk factors. The best thing you can do for yourself, besides, stopping the alcohol or stopping the cigarettes, is getting those appropriate screenings and talking to your regular primary care doctor about any new symptoms you have, any changes you've noticed with your body.
Hmm. What's the worst cancer, Doc? What's the absolute worst one?
Well, the cancer that kills the most people around the world is lung cancer, right? It is it remains very common and very deadly. I'd say in terms of the percentage survival, right? The cancers that objectively have the lowest chance of surviving. We're talking about pancreatic cancer, we're talking about ovarian cancer, we're talking about brain cancers like glioblastoma. So I think the big thing is it's those kind of cancers that you don't feel when they're spreading. Right. That's the thing is skin cancer we catch early because you see it on your skin, right? And you notice it and you go and tell a doctor, oh, I have this lump growing, and they check it out.
Or
You can't see it through.
breast cancer, for example, right? You can see
Exactly,
that.
exactly.
Yeah.
Whereas if you have something growing on your pancreas or on your ovary or in your brain, you may not notice it until it has spread so far that it's you can't cut it out anymore. And now it's so dangerous and it's spread to all these organs, and unfortunately it's too late to cure it. So that's those kind of cancers where it's so important to know about your family history, to get the appropriate screenings, and tell your doctor if you've noticed anything like blood in your stool or your skin's turning a little bit more yellow, or you've had 5 to 10 pounds of weight loss and you haven't really changed your diet, right? Any of those symptoms could be a cancer that's brewing in you.
Have you studied any of the peptide therapies and cancer relations? The you have You're shaking your head.
Well, so
Go ahead.
peptide, right? Peptide's a very big category. Peptide is just protein. We have peptide vaccines now that are being developed to target cancers in people who are at high risk. There are a number of different protein small molecule inhibitors that shut down various pathways of cancer growth. So there's so much research there.
Have you are you familiar with MOTS-C?
MAT-C, MAT.
MOTS-C.
I am not.
It's a 16 amino acid peptide encoded. I'm reading you the scientific, but it helps with a lot of um, metabolic type stuff
Sure.
and cardiovascular. I saw some studies, and I know it's very early and possibly premature. I did an episode on this that they found a lot of cancer patients had low levels of MOTS-C compared to non-cancer subjects. And I can't remember if it was all only in a animal study or if there was some kind of human as well. But those that had cancer had low levels of MOTS-C versus those who didn't, who had higher levels of MOTS-C. So just
Yeah, I mean,
something I wanted to throw out there for you.
the truth is there's a lot of those kind of molecules. Cancer patients tend to have lower levels of vitamin D and lower levels of all sorts of other peptides and molecules. I think unfortunately, the studies have not yet borne out that taking supplements or taking anything that tries to suppress those molecules actually prevents the cancer, right? So it's a little bit of chicken and the egg, right? If cancer patients have lower levels or higher levels of a certain molecule, is that because the cancer causes that or because the molecule causes the cancer, right? So
Right.
I think unfortunately, there's not really good data these days about any of these supplements preventing cancer. For the most part, the supplements are safe, but I will say one thing: if you take any sort of supplements like the MOTS-C or any vitamins or anything, it's important to make sure your doctor is aware because a lot of them can interact with medicines that get prescribed, and those interactions can be very deadly. So it's important that you make your doctor aware of any supplements that you take.
You think there's a cure for cancer out there that hasn't been introduced?
I think 100% there are going to be dozens of new therapies that we haven't discovered yet. I don't think we will ever get a cure because the truth is, cancer is an umbrella term. There are hundreds of different kinds of cancer that all are caused by different risk factors and have different biologies. So I don't think there will ever be one silver bullet that can get rid of or prevent all of them. But I think we're going to continue to improve the survival with cancer and learn more about how to prevent it.
Because you mentioned before, there's no money in prevention.
Not yet. And that's part of why I'm going on podcasts like these and talking to folks like you, because I think the more that we make average people, average citizens aware of cancer prevention, and the more that we hold our politicians accountable, right? The more that we vote for people who are going to invest in public health and invest in cancer research, the more we can actually stimulate cancer prevention and have a lasting impact for decades to come.
Mm. Wouldn't that be something though, if there really was a cure for this thing, like one silver bullet? What
That
would
would be
that do to
nice,
human?
wouldn't
What
it?
would that do to humanity? I mean, there would be way too many people.
Well, I'll tell you for one thing, that in around the world the birth rate is coming down, right? So I think a lot of people say there's too many humans out there, and we're kind of self-regulating that. A lot of countries have people have stopped having nearly as many kids as they used to. But yeah, if we could eliminate cancer or reduce its impacts, that would be millions of lives, millions of years of lives
Wow.
saved, allowing people to easily live into their 70s, 80s, 90s. Right, cancer is becoming the leading cause of death in the developed world. So if you get rid of that, you can have people living decades longer and retaining an impressive quality of life.
Yeah, no doubt. What would you do with yourself, man? Could you imagine what would be your next highest passion thing when it comes to medicine outside of this?
Yeah, I guess if honestly, if I lived that long, I think I would still retire early and enjoy the fruits of life. Go snorkeling, running, water skiing, what have you. But no, I think for me, medical communication is really what I'm passionate about. I do the work in the lab, I do the work in the clinic, but at the end of the day, what I most appreciate is being able to talk to folks like you and being able to explain the findings from the lab, from these clinical trials, to help people understand what cancer is, what causes it, and how to prevent it and how to treat it. And I think, if I had unlimited time and resources, I would continue to write books. I would continue to go on shows and talk to people and get the message out there, because there's such a disconnect these days between the scientific community and the general audience, and that's I think that's a disconnect we really ought to be trying to bridge.
Absolutely. Outsmarting Cancer, guys. Click the link here. It'll take you to the Amazon page if you want to buy Dr. Barsouk's book, and you can find out more information about him here through the links. Radiation. Do you recommend? I mean, there's probably it's not one size fits all, but is radiation something that you typically would recommend for somebody, or do you kind of avoid that path?
Well, when there's radiation therapy, right? So if you have a cancer, you can treat it with radiation. In which case, that's highly effective for certain types of cancer. Obviously, in general, for someone without any disease that you're trying to treat, radiation causes cancer in the long run. So
Right.
the whatever you can do to try and minimize your exposure to radiation, and specifically, I think the big thing we're seeing, a lot of people get a lot of CT scans that may be unnecessary. If you're always going to your doctor and saying you have belly pain and they order you a CT scan every 3 months, right? That
Mm.
sort of radiation, it adds up and it accumulates. So I think people ought to be deliberate and conscientious of the amount of radiation that they're getting exposed to if they're getting frequent scans.
Right. But chemotherapy, even more particular. What's your take on that?
Yeah, chemotherapy, the reason it's existed for 60, 70 years now is because it is highly effective at killing cancer cells. The problem is it's also highly effective at killing the rest of your cells.
Mm.
Right. So that's why there's so many side effects from chemo. And the truth is, a lot of people down the line, chemo actually increases your risk of other cancers down the line. So you can get cured of like a leukemia, lymphoma, and then 10, 20, 30 years down the line, develop another leukemia or another lung cancer from the radiation or what have you. So that's why, once again, the best way to prevent this whole series of events, to prevent this kind of this chain reaction, is to prevent the cancer in the first place, to live a healthy lifestyle and try and do whatever you can to minimize the risk of the cancer in the first place.
Well stated. Dr. Barsouk, thank you very much for your time and for the education today.
It was my pleasure, Nate. Thank you so much for having me.